Welcome to the virtual family council meeting. My name is Jamie Rose. I'm the virtual meeting coordinator. We're going to start out with our confidentiality reminder. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in. We will get you connected to your assigned ombudsman. And just a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. Our meeting agenda this evening, we're going to get our virtual meeting tips from CARIE, and then we're going to turn it over to Kathy. She's going to tell us a lot of great information about how the end of the public health emergency will impact residents in nursing homes. And then we're going to finish up with our upcoming meeting topics. So I'll turn it over to CARIE so she can give you your virtual meeting tips.
There I am on mute. Good evening. You have all been placed on mute upon entry. We will open on lines in a bit so that you're able to share your thoughts. If you would like to speak or have a question, please use the raised hand feature. Once you raise your hand, we will know to acknowledge you and unmute your line. If you hover over your mouse at the bottom of your screen, you'll see the participants tab that can be expanded if you'd like to see who is on the chat today. The chat feature is at the bottom of your screen as well. Once you maximize it, you'll be able to see the question and answer section where you can send questions directly to the chat moderator, Carol tonight, as well as any others during the call. Closed captioning is available during the call. To enable this feature, push the CC icon at the bottom of your screen and choose to enable closed captioning. If you need to step away, you can stop sharing your camera by clicking on the camera icon at the bottom of your screen. You can click it again to start sharing your camera. Concerns and complaints can be directed to the State Ombudsman Office at 717-783-8975 or by email to ltc-ombudsman@pa.gov. Over to you.
Thank you so much, CARIE. And I'm going to turn it over to Kathy Cubit of CARIE. She's going to kick us off for our training tonight.
Well, thank you, everyone, and I appreciate being invited back to speak with you today. You can advance the slide, please. Kathy Cubit, I'm CARIE's Advocacy Manager, and as you can see, CARIE is the Center for Advocacy for the Rights and Interest of Elders. We're a Pennsylvania-based advocacy agency. We offer really all kinds of advocacy, options, counseling, problem solving for just about any issue for older adults and caregivers. We do serve as the local ombudsman for Montgomery County and half of Philadelphia. We also are the organization that it provides the Pennsylvania Senior Medicare Patrol Program, and we do victim services and a whole host of things. So, please feel welcome to contact where I have for help contact if you need any help or information or know anyone that does. Next slide. So this is just a quick overview of what we're going to be speaking at the meeting today. The general overview of PHE, what to expect, some advocacy tips, and I put together a lot of resources for those of you that like to get into the weeds of some of this information. And of course, I'm happy to take questions throughout, but we'll leave time for questions at the end as well. Next slide, please. So the public health emergency, or often just called PHE, has been in effect since January of 2020, and it is now set to expire on May 11th. It has been renewed numerous times since January 2020, but now it will officially end on May 11th. So when COVID hit, it this public health emergency was put into place to create enough flexibilities within the Medicare and Medicaid programs to really try to address this lethal virus and try to be able to respond in the most effective way. Government's not designed to work like that, but I think there were some things that it worked well, others not so much. But nonetheless, now we're at the stage where this will end, and part of the process now is they'll be getting back to the pre-PHE policies. Some have already started to unwind or go back to the way they were, and we'll talk more about some of the changes that are going to happen on as of May 11th. And there are some that are already permanent because of lessons learned, and others will continue beyond that May 11th date. And I'm going to highlight some of those as well. Next slide, please. So residents' rights. We were speaking a little bit before Irma had mentioned about the importance of essential caregivers. And that was certainly one of the, residents lost all their rights when COVID hit. And, it was again under this big umbrella that the purpose was to try to address how lethal COVID was, particularly in nursing facilities and other congregate care settings. But again, lessons learned that, that overly restrictive policy of not even allowing an essential caregiver to help with care also had serious consequences. So many of the residents' rights have already been restored, but there's a couple that are still in effect technically. I don't think they're being used quite as much as they were when COVID began, but nonetheless, they will be officially coming to an end on May 11th. And the one highlighted here is that residents do have the right to choose roommates or refuse relocation within a facility. And obviously during the PHE, or right now, they will often move residents to certain wings or put them with certain roommates for COVID mitigation purposes or infection control. But again, these rights will be restored in full May 11th, but facilities are still going to need to follow infection prevention and mitigation. Next slide. The other right I want to highlight is resident transfer and discharge requirements. This again was permitted. There were residents moved to other facilities because of COVID. Some went from hospitals, instead of going back to their facility, might have gone to a COVID unit in a different facility. But now all resident transfer and discharge requirements must be followed effective May 11th, including the proper notice. Next slide. Medicare went through a number of changes, and one of them, which is a positive change, and unfortunately is going back to a very detrimental policy, is known as the qualified hospital stay or 3-day stay. It really should be called 3-night stay. But most Medicare beneficiaries, in order to get coverage Medicare coverage when they leave a hospital, must be in the hospital to meet this 3-day stay for Medicare coverage to pay for their rehab or skilled care while they're recovering from being in the hospital. So they waived this during COVID. And I should mention with observation status, it's another unfortunate twist to this policy that someone, a Medicare beneficiary could be in the hospital under observation and not technically be admitted, although they have, you know, a hospital band, they're getting in a hospital room, no different than any other patient in a hospital, but they're under this status and that does not count. So nonetheless, people often would go to a facility from a hospital with the expectation Medicare was going to cover, and they ended up with thousands of dollars in bills, and we're fearful this is going to happen once again. This will require Congress to pass a law to change this policy. It's not something Medicare can change through regulatory reform. Next slide, please. Another Medicare policy that is going back to you know, the normal on May 11th is this maximum of the skilled benefit period of the 100 days. This was also waived during COVID because COVID often, you know, you've heard of long COVID, so a lot of folks had problems related for many days, and they Medicare allowed, normally you have to have the 60-day, what they call a wellness break, where you're not billing Medicare for that particular episode of illness and before a new benefit period starts. So that is going to resume May 11th. Next slide. Now I have this under both categories because this is related to the training of nurse aides in facilities. So prior to the PHE, CMS required, or the Centers for Medicare and Medicaid Services required that nurse aides would have to work, be trained, go through at least 75 hours of training and then certification through a test before they could be employed by the facility. And they gave nursing facilities 4 months to complete this process. So during the PHE, this was originally waived, and then the industry came up with an 8-hour online training program and claimed that other training was happening as the aides were working. And they continue to want to fight for less training. And of course, advocates and loved ones know how important it is to have people trained for, what at times can be very challenging work. So anyway, this waiver stopped in June of 2022, but there was a number of states and individual facilities that requested continuing with this waiver. So they applied and were granted to continue with this temporary nurse aid situation. Pennsylvania is among those states. This will end on May 11th, but facilities will have 4 months from May 11th to make sure that any temporary nurse aides that they have hired will need to complete their 75 hours of training and testing, going forward and moving forward. So we can go to the next slide. Thanks. So some requirements that are continuing after the PHE ends, a lot has to do with the telehealth requirements. Many for both Medicare and Medicaid, the flexibilities around telehealth have been extended through December 31st, 2024, including the ability to use telehealth in nursing facilities for some of the physician visits. Some of the telehealth provisions have been made permanent, but they tend to be more around behavioral health care and counseling. The use of telehealth for those types of services. Next slide, please. So some other provisions continuing, nursing facilities are going to need to continue to report their COVID data of any outbreaks or cases within the facility, and they will need to let residents and families know, and this will be required through December 31st of 2024, unless CMS changes this date. A lot of these things are, often are in flux. If something ends, they usually don't open that up again, but some of these with these end dates, they could possibly adjust. Nursing homes are also going to be required to continue to report their vaccination status through May of 2024, again, unless CMS changes the date. And they're also going to need to continue to educate and offer COVID vaccinations to staff and residents through May 2024. Again, unless CMS changes the date. And now the federal staff vaccination staff mandate has been challenged numerous times in court. So far, it hasn't held, but it is possible there could be a court case or again another policy decision based around the efficacy of vaccines that may change this policy. But this requirement as it stands now will continue through May of 2024. Testing requirements. We're all familiar with how often residents and staff have been tested for COVID throughout this public health emergency, and for certainly good reasons. And the CMS requirements around testing are ending on May 11th with the end of the PHE. But the Centers for Disease Control and Prevention, or the CDC, still has guidance and recommendations around testing. They're not technically mandates like the CMS rules are or will be. Won't be after the 11th, but the CMS does require nursing homes to follow infection prevention and control standards. So the assumption is that they will be following the CDC guidance, but we'll have to follow that. But that's the expectation at this point. Next slide, please. Medicaid. Pennsylvania calls this medical assistance, but it's really known as Medicaid nationally. And this is, I'm going to speak here not only around nursing facility residents, but also in some aspects, all current Medicaid beneficiaries, because this is going to be a massive undertaking, and I'll get to that in a minute. I did hear someone before we officially started that mentioned they were from another state, and I just want to mention that what I'm speaking now, Medicaid is a federal and state program. So each state has to follow certain federal requirements, but states also get a lot of flexibility in terms of how they administer their programs. So the person that was from out of state, you should look on your state Medicaid agency's website for more details about how they're going to be unwinding and doing this process I'm about to describe. But although there will be certain advocacy tips that will apply certainly outside of Pennsylvania. So prior to the PHE, once a resident was on Medicaid, or anyone getting Medicaid long-term services and supports, in Pennsylvania we call that community health choices, had to go through an annual renewal process to redetermine eligibility. Pennsylvania never technically stopped going through this process. But what the PHE required was that states could not disenroll anyone from the Medicaid program, regardless of category. So if it was a child, if it was SNAP benefits, any kind of Medicaid category, they could not disenroll the person, even if they no longer technically met eligibility criteria. So this prevented a common problem that occurred prior to the PHE called churn, where people were still technically eligible but couldn't get through all the paperwork and would eventually end up back on again. But anyway, we'll get into more of that. But anyway, this process is again has started. Originally, it was connected with the PHE, but a law was passed at the end of December that separated it, and essentially this process has begun, and not only in Pennsylvania but across the country. So this Pennsylvania is going to take about 12 months to what they call unwind, which means they need to go through every current Medicaid beneficiary to determine if in fact they are still eligible. And so now they can begin to disenroll people. I should just say, before, they could only really disenroll people if they moved out of state, if they died, or requested to be removed. So states, including Pennsylvania, some of the work they're going to be doing automatically. They call it ex parte, which means they're using data they have in computer systems to be able to cross-check financial information to minimize how much information the individual would have to come up with and report back to the state. But they cannot, no state's permitted by CMS to disenroll an individual simply based on this process. They can renew someone if everything looks fine, but they can't disenroll. They still have to send paperwork, either through mail. They're trying to do more and more electronically, and have that individual verify if that information is in fact accurate. And again, if they end up not meeting requirements, they then will be disenrolled. So the sheer number of people has grown during this time in terms of unprecedented records of people that are currently on Medicaid, not only in Pennsylvania, but across the country. And the other issue that's happening is we talked about nursing facility staffing issues, but also there's a staffing crisis, it seems like, everywhere, including the county assistance offices, which process these applications. So we're anticipating that, maybe June, July, we're going to start seeing a backlog of cases piling up. We are monitoring as advocates, and the state's trying to do everything they can with the resources at hand to keep up with the workload, but nonetheless, the crisis could be headed our way. Next slide, please. So as stated, everyone on Medicaid or medical assistance in Pennsylvania has to renew their Medicaid annually. And they will now be disenrolled. The process has started on April 1st. For some folks, they're dividing the caseload up across the calendar year, and they're trying to keep people in Pennsylvania as close as possible to their normal renewal date. And so that's how they kind of divided things up. Now, if for those folks living in a nursing home, and you would know that you're on Medicaid, either A, if you help that you helped your loved one go through the initial process, which is extremely difficult, requires 5 years of records, or you would know because the state of Pennsylvania requires residents to contribute to their care when they're on Medicaid, and that individual would only, the resident would only get $45 a month for their, what they call their personal needs. We're actually trying to fight for an increase in that, but that's a story for another day. But that's how you would know if you were if this is related to you in Pennsylvania. But anyway, there's two parts of eligibility for people living in nursing facilities. One is the financial, which is really mostly what we're focusing on today. And the second is functional eligibility. So there's basically two reasons someone living in a nursing facility today with Medicaid paying the bill would be either that now they all of a sudden have excess resources that make them ineligible, or they maybe got better and no longer technically need to be in a nursing facility setting. So those would be, the reasons you also, for someone that maybe would go through this process and, you would end up saying, oh, you're no longer eligible. So most of the times, this is not the case for people, but there are some, especially over the course of since 2020, that a resident may have gotten either an inheritance, or if they were married and the community spouse perhaps passed away before the person living in the nursing facility, and then all of a sudden now they have the resource of the house that could make them ineligible. And in those cases, you may want to seek out a private elder law attorney because there are ways you can spend down and then again not disrupt having to either leave the facility, and also perhaps preserving some additional money, because again the personal needs allowance is so low in Pennsylvania. Next slide, please. So as stated, it's very complicated to apply and renew Medicaid in a nursing facility, or if you're living in the community, but you're considered nursing facility clinically eligible. Prior to the PHE, this process happened seamlessly. The business offices tended to take care of it. They may have asked the families for certain information at times for the renewal. The one concern we have now is that, again, back to staffing, not only has nursing staffing turned over in nursing homes, but also administrative and business office staff. So we're not certain how familiar they may be with the process. And again, the county assistance office had a lot of, they have shortages. They've had a lot of retirements, less experienced staff. There's a lot of room where errors or, and timing, so to speak, is also important, because if there's delays, that could also end up with someone being terminated from Medicaid coverage. So again, part of this discussion is just so you have these flags in your head. God forbid this should all go smoothly, but if not, we'll talk about resources shortly. But just so you're aware, number one, this is happening, and number two, where to go to get help if something seems to have gone awry. So the one thing I also want to mention that's on this slide is that there are cases that that if someone either in the community or let's say the nursing facility had a delay in getting the information in, because again, there's certain timeframes that must be followed with this process. There is something called the reconsideration process. So this is an effective option to be aware of, again, either for people out in the community or in living in a nursing facility, because if you know you're eligible, but they're saying you're terminated because they either didn't get certain paperwork or what have you, you can take up to 90 days from that date of termination to submit the right paperwork without having to start the whole application all over again. So that is, you know, I just wanted to point that out. I don't know, do we want to, I noticed a couple things popped up in the chat. Do we, I don't know, do you want to move to chat questions or?
That would be fine. I have somebody wondering if you would be willing, Kathy, to share your PowerPoint slides.
Yeah, Jamie has them. And I think she tends to send them out after the, I don't know. I'm sure you'll get them soon. I don't want to say when, but I know.
That's fine, yeah. And we have a couple questions in here. When you were speaking of the functional eligibility now, would an assessor have to come back out to do that eligibility, or is that, you know, when they are medical assistants in the beginning, the assessor has input into, yes, they need nursing home level care?
Right. So the way the functional eligibility, once you apply and you're living in a facility, it works different than at the time of application. You still have to meet the functional eligibility, but what happens with residents living in nursing facilities, they use the data from the care plans and information put in from the nursing facility. That's pre-populates, and the decisions often based from more of like a, I don't want to say like a paper or a computer review, because these evaluations are being done, you know, as part of the care planning process in a facility, but someone does not, a new assessor does not come out like occurs at the time of application. I don't know if that's helpful or not.
Very clear. So it's really the decision of the resident / nursing home.
The nursing home is really the one that is populating this information that's supposed to be part of this whole, you know,
The MDS.
the
Yeah.
MDS. I didn't know how familiar people were with that. Thank you.
Right, but they have a certain system, yeah.
Right, but if you're in the community, someone does come out and you do have to go through a functional assessment, but in a nursing facility, it works slightly different.
Okay, so with this isn't going to change anything. The way it's just going to go back to the way it was. Yeah.
Correct. And I just want to say, you know, some people do improve. Now, if you're told you're no longer eligible because you're no longer functionally eligible, and you disagree with that, you need to appeal and appeal in a timely way.
Okay. And there was one which is going way back in your slides, you know, probably to page 10 or whatever, but it's going back to that 3-day hospitalization stay and the Medicare stuff. And the whole thing about these swing beds. I was wondering if you could talk about that a little bit, Kathy, that sometimes they put somebody in a swing bed in the hospital, but they really don't move or anything. It's the same problem like observation.
Yeah, I don't feel equipped to answer that. My understanding of swing bed is when a hospital can kind of turn a hospital bed into like a nursing home bed.
Yes, and then they, yeah, and that's what they do. And they're supposed to tell the person, but again, how sick are they and do they really understand what it means to be in a swing bed, you know? So then they bill their Medicare, so they don't really have as much coverage for therapy and stuff like that when they go to the nursing home.
Yeah, I don't want to, again, I'm a little uncomfortable. I'm not sure, but my guess is that if the hospital is using the swing bed as a nursing home bed and the person did not meet the I call it a 3-night, but you know, this 3-day qualifying stay, my guess is they will be charged now come the effective the end of the PHE. That would be my understanding, but I don't want to say with absolute certainty. The other thing I should mention, if a Medicare beneficiary has a managed care plan as their Medicare coverage instead of original, those rules can often, you know, be dependent upon that particular plan. So sometimes people do not need to be in that many days, but the managed care plan, the Medicare managed care plan might say, well, we're only going to pay for, you know, 3 days or 5 days or something like that. So it is kind of like a Wild West kind of situation. And I'm not trying not to answer questions, but this was a problem that I was glad to see go during the pandemic, and it's going to come back. I mean, that I can say clearly, but you know, again, things really vary from individuals. I don't know if I answered these questions.
No, it's just making us aware of those things. And I don't see any other questions right now in the chat.
Okay, so I think we could go to the next slide, please. So as I mentioned earlier, Pennsylvania moved to a Medicaid managed long-term services and support system. The process was actually happening during PHE, but now we're fully there, and it's called Community Health Choices. So each nursing facility resident that's on Medicaid has one of 3 CHC or Community Health Choices plans as their insurer that's technically paying for their care, and they are assigned a service coordinator from that plan, and they're supposed to be available to help with this process. But I do need to tell you, and this is something we are fighting because CHC is going to be procured. The current contracts expire the end of December of 2024. The ratio of service coordinators to nursing home residents under Community Health Choices is 250 residents to 1 service coordinator. So we don't feel that is sufficient. I think a lot, the Community Health Choices system depends more on the nursing facility to address these all kinds of problems and needs. But we feel that if the residents are part of Community Health Choices, they should have access, realistic access to a service coordinator. The LIFE program is another, there are a few, most LIFE participants live in the community and use the LIFE Center, an adult day type center. But there are some life participants that do need to go to a nursing facility and are unable to return to the community. So, you know, they'll be going through, all life participants will be going through this process. But again, there are some life folks living in nursing homes. A dual special needs plan, that's another plan someone could have, like I mentioned earlier, for their Medicare. They can choose, if someone that has Medicare and Medicaid can choose one of these plans to provide their Medicare coverage. And these plans, because they also are supposed to coordinate Medicaid and Medicare benefits, have certain requirements through the state or any state where they operate. And they are supposed to be helping with this renewal process. Also, the DSNP plans have some ability, if they think one of their participants was terminated for what they call procedural reasons, meaning a missed deadline, lost paperwork, meaning the person's still technically eligible, but something happened that it caused them to drop off. They have, I believe it's like 60 days to, if the person's going to come back on, they can keep that person on, even technically that they don't have that coverage. So that's just another protection for folks in those plans. So I think we can go to the next slide. So part of, and again, this is broader than just beyond people living in nursing facilities, because I think inevitably we're all going to know either a family, friend, neighbor that's going to be thrust in this situation where they're currently covered by Medicaid for any number of benefits, and they'll lose coverage. So part of, again, there are people that are going to be legitimately no longer eligible and will lose their coverage. If you know you fall in that category, honestly, appealing isn't going to do much good, because the information's correct. If the information's correct and you don't meet the eligibility, then there's nothing really to appeal. But if you're not sure, appeal. But anyway, part of the goal is to get people to other coverage or benefits if they are in fact losing Medicaid coverage. The bulk of people are going to be not people on Medicare, younger, working age adults, and they are going to be directed to the ACA marketplace nationally. In Pennsylvania, we have our own exchange called Penny, and there are subsidized plans, health insurance plans that people will get matched to, and children will be moved to CHIP. You may know some grandparents raising grandchildren, so this is a resource for them. And again, we talked about the 6 months. I said 60 days. I should have said 6 months. That information's here as well. And there's a number of other services that won't necessarily be as comprehensive as Medicaid, but could be helpful for people to know about to make it through. Next slide, please. So the other thing that we're concerned about, that there's not much information, is that some people who became eligible for Medicare during the public health emergency, who were getting Medicaid benefits, may not have enrolled either at all in Medicare or in all the parts of Medicare that they're supposed to do. There's what they call special enrollment periods. And there is one specifically designed for this unwinding period that someone, again, has to be done in a timely way, could apply for Medicare and then not have a lifelong penalty. Because if you do not sign up for Medicare when you're supposed to sign up for Medicare, you know, like when you, for example, when you turn, there's a period around when you turn 65, you can have lifelong penalties for delaying to sign up. So anyway, I wanted to point that out. We have a program in Pennsylvania called PA Medi. Every state has a state health insurance program or state SHIP. Pennsylvania calls it PA Medi, and they provide a lot of options counseling. So if someone is losing their DSNP because they are no longer eligible for Medicaid, or losing Medicaid and need to look for better prescription drug coverage, PA Medi is a great resource for that. The Pennsylvania has a PACE application center, which is a great resource. Anyone, any older adult can call, and if they, you know, they'll hear about different options. If they willing to provide their social security number, the application center can put them in for all kinds of applications for benefits that could really help out financially and otherwise. Next slide, please. So here's some advocacy tips. One is to keep information up to date with, this is more for the general public, but a lot of people in the general public don't keep their information, contact information up to date with the county assistance office. And there's a program called Compass, which will send Medicaid recipients text notice. They can find out when their renewal date is. Obviously, if someone's living in a nursing home, the state has the right contact information, but it's still an important general point I want to raise just in the broader context. Anytime you get information, or if the facility is asking you for information, you want to respond, you know, as quickly as possible, and be sure to respond, because it could end up resulting in loss of coverage. If you get a termination and you feel that you are eligible, you want to appeal, or again, use the reconsideration period to get additional information in to regain your Medicaid coverage. One concern, and I have here for the long-term care ombudsman program, which I know you're all familiar with from these calls, is that there's something called involuntary discharges, where a nursing home could come to a resident or family member and say, oh, I'm sorry, you have to leave, you know, in 2 days or the end of the week. That is not allowable. There has to be proper notice. You know, again, because of a lot of the change in ownership, we don't want to see this process used as a way that people could end up being discharged when they have rights. And so again, be sure to lean on the ombudsman program if you get any kind of word or written or verbal notice, and you don't feel it's appropriate that you should be leaving. And again, we just talked about the special enrollment period, and knowing where to turn for help. We can go to the next slide. So again, I think you can kind of whip through, I'm not sure who's doing the slides, I forgot, I apologize, but now we're hitting a lot of resources. We talked about the long-term care ombudsman program. I have the next slide, I believe, is PA Medi, and I think the next slide is the PACE clearinghouse, or rather the PACE application center. The next slide This is Pennsylvania's. In the top, you can see the link to their unwinding website. This is for everyone. You can see all their communications and very detailed information. Next slide. The next, I guess, 3 slides or show some of the information they're sharing through this website and through their social media and texts and other messaging about this process in other states. And CMS has communication toolkits, as do other states. Pennsylvania has something called PHE helpers. You can sign up at this link, and even, you just would get occasional emails about different information around this renewal process. Again, it's geared more to not so much for residents or Medicare beneficiaries as much as the general process, but that is an available option if you're interested. Next slide. And then Compass that I mentioned earlier is also if this is set up for even churches or other groups that help people apply for Medicaid. You can get an account and help track a lot of the renewals and applications. Next slide. And again, this just gives more information. And next slide. So here I have, again, a lot of resources if you want to get into the weeds of this process. I'll point out that second bullet really has a lot of the resident rights information that I was, and Medicare changes I was referring to, and when certain rules went back to normal, and likewise, so it's slightly different than the other resources here. Next slide, please. Here's just, I try to put on one page a lot of resources, not only for people living in nursing facilities, but others. We talked about a lot of these already, but anyway, this is just, I think, a helpful resource page to help you with this process. And again, I can't emphasize enough the ombudsman if you're having any difficulty. Next slide, please. These are some community-based organizations. Again, I have our CARIE line, the area agencies on aging. They're available all across the country. They'll be particularly helpful for people losing maybe home and community-based services, identify other resources. The Pennsylvania Health Law Project, we work very closely with them on advocacy around the unwinding of the PHE. And they have webinars and great self-help materials on their website. In addition to, they provide free legal services to people of all ages, health-related across Pennsylvania. I have CLS. They're another great resource, but they serve only folks in Philadelphia. And then the Pennsylvania Health Access Network is not a resource for older adults, but they do help with penny and chip issues. They're great advocates in that arena. So I wanted to point this out. I can tell you the any legal services, and honestly, a lot of these community-based, ourselves included, the volume is overwhelming. So, you want to move quickly because you'll encounter delays because how busy things are. And I think that's it. The next slide, I think, is just the question slide. Oh, and it looks like someone put health law in the chat, so you beat me to it.
Yeah, Jeannie was vouching for the Pennsylvania Health Law Project and said it's excellent program. I'm right there with you. I feel privileged to work with them. They're great people. So I know there's a few minutes left. I want to see if there's any other questions I can answer. We have folks saying thank you so much, Kathy, for your presentation and your knowledge, sharing it with us.
It's my pleasure. Thank you for having me.
Nobody raised their hands during this period. Thank you.
Well, thank you so much. That was so many good resources in there too, Kathy. Like, whew. Some of them I didn't even know, and I've been around a minute. So that's pretty exciting.
Well, that makes me feel good that one thing I like about my job, I feel like I learned something new every day.
Absolutely. It's always a pleasure to have you. You bring such good information, and I'll have to rewatch this one or
Thank you.
two times to absorb it all.
I know, especially the Medicaid information. It's just really, and this is, I think, what's going to add to what crisis we'll be encountering, because it's just such hard information, to communicate. Anyone that's been through that application, I'm sure, can attest to how challenging this all is.
Absolutely. It's very, it's a complicated process. I know you said that a few times, but until you go through it, you don't quite
Exactly.
realize. I've did it with both my parents, so it was, whew, it was a process.
Exactly. Unfortunately, they are making some changes to try to automate, because it's just really hard for most people to come up with the 5 years worth of records. So they are trying to do more in terms of automating that. Pennsylvania's behind other states in that regard, but hopefully in the future we'll have some progress in that front, but not quite there yet.
Well, more advocacy for us in the days to come.
Exactly. Never a shortage of issues.
Absolutely. I don't see anything new in the chat. Did you get anything directly, Carol?
No, I did not. Just a lot of thank you, and keep up your wonderful work, Kathy.
Thank you.
Absolutely. So we're gonna review our upcoming meeting topics. So believe it or not, May 16th is going to be our 3-year celebration of the Virtual Family Council. We're pretty excited about that. And I found this interesting that Kathy mentioned this during the presentation, but on June 20th, we're going to have our peers back on with Candy Scheffler, and they're going to talk about this big project that they're working on how to increase the personal needs allowance. So they have a really neat new project for that, and they're going to share that with everybody in June. So we're really excited for that, because $45 just doesn't go as far as it used to. And it's been quite a long time since that was increased. So we'll be having them on to share their awesome new project. And if anybody has any questions or concerns, send those over to the State Ombudsman Office, 717-783-8975, or email j@ltc-ombudsman@pa.gov. Thank you, everyone.
Jamie, we did get one more through the chat, and
Wonderful.
Irma is reminding us all, if we want to help with getting the Federal Essential Caregivers Act passed, that we should contact her. And she's giving her email here as Irma at owlking.com.
Well, thank you, Carol, and thank you, Irma. All right, everyone, have a fantastic evening, and we'll see you next month. Take care.
Thank you.